Hey you guys, it's Jessica. Welcome back to my channel. So the last time we talked and I explained myself about the first 10 weeks of class before clinicals about the aseptic technique. So today we are going to talk about the first semester's books, the books that I read for this past semester. But before we get into that, definitely like, comment, and subscribe. I greatly appreciate it. Let's get to it. So, the main book you are going to go through is the surgical technology for the surgical technologist. Hmm. So, this is the main book that you will be really, going through. You're going to use this book for the whole program. So, this is which edition? Fifth edition. So, see that says fifth edition. And it has the procedures in here. Like I say, it talks about the aseptic technique, how to set up the back table, taking care of the surgical patient. So, they wrote in it, highlighting stuff and everything. But this book is like the main book you will definitely will have to, keep up with, because if you don't have this book, you're going to be lost. So this is right here, the first book that you have for the whole program. So the whole program, definitely. This book right here is Introduction to Surgical Technology, and this is basically the exact same class, the Surge 10. So this book will mainly be used for Surge 1010. So yes, Introduction to Surgical Technology. This one right here, we call this the MAVSI book. I don't know why, but I will find out of why we call it the MAVSI book, because it has the initials at the bottom, says MAVCC, so we call it MAVSI. My teacher says that. So hopefully by the time next video, I'll have an understanding of that acronym. And also, this book can be used for Surge 1020 also. So we use this for both classes, but mainly in 1010. So yeah, so we use it for both for the first semester. And I believe we still use it now because it has a section on microbiology and pharmacology. So yeah, so we use this for 1080. 10, 10, 10, 20, and we're using it now for pharmacology. So I forgot what exact number that is. But yeah, so this book too, also for the majority of the part for the first two semesters right here. So this book is the surgical techniques. So this book is usually used for surgical technology 1020. So yeah, Surge 1020. And this class is the principles of surgical technology. So with this book, I think they talk about, positioning, prepping, cleaning the instruments, you know, certain equipment. So basically it's just like an outline of what you need in an OR room and how to do certain little things during surgery and everything. So yeah. This book right here, the surgical equipment and supplies, the second edition. So this is what you use for 1020, because it kind of overlaps with the surgical techniques book, MAVSI book. So they kind of go hand in hand. So you will probably be reading the same stuff probably like twice or so, but which is not bad. So kind of stays in your head a little longer. But yeah, so this book is for the 1020 surge class, and let's take a look inside of it. So it gives you shows you little equipment pictures and everything, and like little robot, yeah, little robot supplies, and then probably like little medicines and everything, locals, anesthetics. So yeah, it kind of gives you an idea. It's more pictures. I mean, you read you read a little bit, but it's always good to have pictures to kind of get a better understanding of what you're reading. So yes, this is for Surge 1020. So we're also using this in our second semester also. So from time to time, for everyone, because we go into specialties now. So from like GYN, orthopedics, neuro, plastics. So yeah, so it kind of gives you an idea of, like I said, what you're, what you're going to be dealing with in the OR rooms. So I think this book is pretty neat and some interesting pictures and how. So yeah, there we go. Some interesting pictures. But yeah, second edition. There we go. The next book is the Differentiating Surgical Instruments, and this is the second edition. So this right here, you're going to use this for basically, like I said, the whole semester, because these are all the instruments that you're going to be using or have an idea what you may be using in the future. So got a little, I highlight a lot. I do. I'm color coordinated and everything, so I have to highlight it. If I don't highlight it, we're going to be lost. So yeah, these are very, very interesting too. So here, you really don't have to do that much reading. It's just, it gives you an idea of what the instrument looks like, what it's used for, and if there are any alias names to it. So yeah, I do get a kick out of this book because some of these instruments are really, really weird. So even when they are using them, it's it's interesting. See if I can find you guys a nice picture. Here we go. Here's a good picture. So this right here is the Book Walter retractor. Well, system. It's a retractor. But yeah, so you use this for like open abdominal surgery and everything. So it's like 28 to 30 pieces. So you have to count these before you go into surgery and when they're closing the wound. So like like I said, you hook up all these little pieces, you gotta count all of them back to the nurse before they close that person up. Because when they close the patient up, you got something left in there. That's not good, leaving foreign objects in the body. Not at all. So yeah, so it says count in the tray. I put too many pieces. So yeah, some text will let you know, you can count these pieces within the tray that's given to you. So, make your life easier. Work smarter, not harder, boo. Okay. Also, with the books that I just showed you, we also had handouts from our instructor. So so each week that we had something, she would kind of give us like little handouts and everything to put in our binder. It, like I said, it went hand in hand with those books of what we were learning, what we needed to know for whatever upcoming tests. So that's how that played out. DVDs to watch in class. So that was also interesting, kind of, seeing like little old videos or new videos too. We had a mixture of them. And, like I said, it will go through the whole aseptic technique of, how to open up the table and everything, back tables, the positions of, how to set the patient when you're getting ready to do surgery, because there's certain surgeries that, some patients have to be positioned in order to get to that, the surgical site. So that's how we do that. Along with that, we also got practice tests, and they went along with the first book I showed you. So it was the surgical technology book for surgical technologists, the book I showed you. So that was, yeah, the very first one. That right there went hand in hand for each chapter, which still does. Like I said, she still gives us practice tests that goes along with that, and we just kind of practice that along the way, and that helps out a lot for the tests, because some of those test questions she will kind of take them off and put them onto our actual tests. So that kind of helps too with the practice test, definitely. So today I decided to give you guys a little insight on some medical terminology today. So I will be giving you bits and pieces of a word, maybe a prefix or a suffix or maybe a root, and you guys comment below of what you think the meaning of it is. The prefix that we have today is pre. What does pre stand for? What I'll do is I will give you guys a couple of examples of what the word pre is in, and I'll probably give you an idea of what it's used for and the meaning of it. So the first word is preoperative. Pre-operative. Next word, prenatal. Prenatal. Comment below of what the prefix of pre is, along with the examples I gave you, and comment below. If this video helped you guys in any way and you liked it, definitely subscribe, and I will keep on bringing more information together for you guys. So definitely like, comment, and subscribe. Greatly appreciate it. And you guys have a wonderful evening. Bye.